No, I'm still fading. Because with the legs, I'm going to be doing a couple of different things. So the whole, and you want me to stand the other way? Okay. I just want to make sure I have access to it in case I want to review up or down. And that's the great thing about an art table is that you can, in the middle of the game, adjust the table. And sometimes you need to, and that's fine. Okay, so we are going to start. Right? Remember, you take sheet at the level of the knee. My hands up, full out of front. Pass it underneath. So, yeah. And then towards the head. Okay. Now I want hip area here. I want to have access to it. But you notice I did not put a bolster in. Right? I am going to be moving the hip around. The bolster is just going to get moved. I may use the bolster later for some adductor work. So I might ask for a bolster then in a few minutes. Okay. I have a couple of options. I can warm up the entire leg and then go into the hip, or I can just go into the hip, which is what we're going to do. We don't necessarily need to warm up the leg. Although if we are coming from another body part, we might just want to introduce what we're about to do with a couple of passes. 1, 2, just, hey, I'm here on your leg. And we want to go up. So notice that I'm using the back of my hand to enter the hip space. This is just a nice safe way of entering this space instead of going right to palpating for the ASIS because people are typically like either ticklish or like, hey, what are you doing? Okay. So, hey, entering the hip space. Okay. This is also the point at which I am palpating for the ASIS. Instead of going in with my fingers, if I have a broader tool, I can feel it much easier. Okay. If you cannot feel it and you don't really want to go poking around in there, you may ask your client, can you point to your hip bone for me, please? Thanks. And there it is. Like you can ask them. That's fine. That's acceptable. Okay. All right. So she said she's been having some hip issues. And I'm just generally palpating just to make sure that I know where I am. Seeing with my fingers. Just getting an idea. Okay, so here's the iliac crest as I work my way up. Just gently feeling, but not too gently because I don't want to tickle her. Okay. So if I know where I am, then do you mind if I roll this up? Okay. I can roll this up to the ASIS. Okay. And then what I'm actually going to do is I'm going to be sinking down in the iliac fossa with my fingers. So those of you that can't see, you might want to come on this side. I haven't done anything yet. I'm just showing you where you're going to be. Okay. So we're going to be on this side of the ASIS. All right. So the last thing that you want to do is just go poking around in here. Once you find where you're going to be, stay there and don't just keep poking, okay? And to get into the iliopsoas, we want to put it in a shortened position because in this position, it's lengthened, right? Or it's in neutral, but if it's tight, this might be a bit much to try to curl your fingers into the iliac fossa. So what we're going to do is I'm going to have her bring her leg up like this. Now notice I held the drape as I did that. Okay. That's just to keep her modesty. And of course, we're in a room full of people. Yep. Okay. So I'm going to go back in, right? I'm going to be on the medial side of the ASIS. My fingers are going to curl towards myself. And this is very important. If you just go in with straight fingers, you're going to hit viscera. Nobody likes having their guts poked. We want to hit the muscle, not the viscera. Muscle, viscera. Okay? All right. So you ready? Okay. So my fingers are going to be curled. You got to have your nails short, by the way. Fingers are going to be curled. I'm going to ask you to take a breath in. As she exhales, my fingers sink in and curl. Okay? They're not in that far because you're kind of tight. Is that okay? Does it feel weird? Yeah. Mm-hmm. It feels a little weird. Most people don't experience this unless they're in massage school or they have a therapist who does work. And all I'm doing is just gently rocking back and forth on that tissue. Okay. Notice I'm not going anywhere. My fingers are staying there. I'm just going like this. Okay. Just like that. Take another deep breath in. Something just okay. So I did, when I went a little more inferior, I did hit the inguinal ligament. Feels totally different than the rest of the tissue, so I knew I needed to adjust my fingers more superiorly. Is that okay? Now, just rocking back and forth here. Not too bad, right? If they are ticklish in this area and they laugh, they will kick you out because the abs are there. So we're going through abdominal tissue into the iliopsoas. Okay. Got a little bit of softening there. Not too bad. And she's breathing, so I know it's not too tender for her. All right. So I'm going to come out of that space. Nice and gentle. And then I can redrape. If we need to do other things, and we might, that's fine. Because while we're in this position, we might as well. I'm going to go over the sheet this time so you can see my hands. Is that okay with you? Okay. So we can also do a pin and stretch in this position. So right now it's shortened, right? Right. Take a deep breath in. Watch my fingers. Okay. I sink in with her breath. I'm pinning the tissue down. And then I'm going to ask her to straighten her leg as she moves her heel along the table here. Perfect. See, I didn't move my hand. Okay. I can do that again. I'm just going to support her. Take a deep breath in. Whoa, whoa, whoa. Jump the gun. It's all right. No worries. Deep breath in. Exhale. And you sink in. Then she goes. Exhale. Fingers are still curled. So you're curling back towards yourself. Okay. You can do that pin and stretch. That's really nice. Or if somebody's really tight or really sore in this area, I'm going to take the leg, okay, and I'm going to move it around as I sink into the iliac fossa. Okay, you're secure. Okay. All right. So again, breath in, and she exhales, and I sink down in with my fingers. Just lean forward. Okay. And while I'm in there, I'm going to take her in a couple different directions. My fingers are not moving. This is all her. Okay. I can also, if I have the drape nice and tight or tucked in, I can also take her up in the air a little bit. Go. Let's tuck that behind you here. Want to do that one more time? Wait, I lost my landmark. There we are. Okay. Inhale. Exhale. I sink in. And then I have, with my body, I have control of hers. Okay, so I can go in different directions with this. I don't have to go this fast. I'm just showing you what you do. A little bit of flexion, a little bit of extension, back and forth, side to side. Okay. So you can use their body to do the work instead of having to use your fingers. So, because it does get a little tiring having your fingers that deep in the iliac fossa. Okay. You good? Okay. You can do a little bit of lengthening with this muscle, but you're going to have your client scooch to the side of the table. So if you could scooch toward me, and we're scooching and we're scooching, keep your body there, okay? So that they can feel your body and know when to stop, okay? And then all you do, take the leg off the side of the table. Now see my body still here so she doesn't roll over. Opposite hand goes on the opposite ASIS. This is to stabilize, okay? Now all I'm going to do is add a very gentle stretch towards the floor. So notice I'm not moving hardly at all. Like this is where this to this, right? There's not a whole lot to this. You're not trying to jam their foot towards the floor. You're just giving a little bit of lengthening in iliopsoas. But again, your body needs to be stable here because you don't want them rolling off the side of the table, and you have to have your hand on the opposite ASIS. A little tiny bit more. And she breathes, and you breathe, and everybody breathes. Does it feel so good? Then when you're finished, you help them back on the table because you don't want them to use a muscle that you just tried to lengthen. Okay. Okay. Pretty much done with iliopsoas. So I showed you several things to do in it. Okay. Now we can start working into the thigh. She has a couple of bruises that I do want to avoid. And I know Katie showed you this, but I'm just going to remind you, as you're going up towards the genital area, so I'm going to turn the fingers off. So your fingers aren't pointing to the genitals. It's just a sensory cue, safety issue. So the thigh has some big muscles, so you get to use your big tools, okay? You can use flat fists or soft fists. You can use palm heel. I kind of like this one. Like a rolling effleurage with your palm heel. You notice I get all the way up the entire length of rectus femoris, and I can get all the way up the entire length of vastus lateralis. Oops. So because this is a large muscle area, I can explore. I can use forearm. See what I did there? I control her leg. So now I'm on vastus lateralis. And if I really want to specifically work vastus lateralis, I control the leg. I can put her into medial rotation, so vastus lateralis is right there, and that way I avoid going hard on the bone. Okay. All right, so vastus lateralis, you see where I am in relation to the IT band? I am anterior to it. Stay anterior, folks. The more lateral you get, the more tender it becomes. Especially if you're medially rotating the leg, it's going to be right in front of you. You shouldn't need to come down like this, or, if you feel your biomechanics doing this, you're definitely too lateral. And also you don't have very good biomechanics just now. Okay. My weight isn't here. This is just me holding her steady. I'm just leaning in my work. Okay. And I'm just checking in with her about the pressure because it's the first time I'm really working with her. So I don't really know what her body is used to. However, she is soaking up my lotion quite a bit. And one of the things that you will get used to the more that you do this is being able to feel when the tissue won't let you push in anymore. So you don't grind through it, you let it tell you that that's about as deep as I can go here. And right about through here where my thumb is, I start to feel some restriction. Right in through there. Her face just did a thing. I saw it. Okay, so yeah, right about through here. And I can come in and I can address that specifically. You guys do this thing, right? You warm it up, do some cross fiber. If I needed to, if I felt that that was really tender and I asked her, it's a big muscle, so I can come in with an elbow. All right. This is a really light elbow. All my weight's in my feet. I didn't really. That was a very light. I wasn't using the elbow to do a trigger point. I was just coming up to that one spot. Absolutely. I'm not going to show you like really anything very specific for this because it's large muscle area. You already have the tools. Just get creative. Okay. I will, however, show you some specific stuff for the adductors. So we're going to put our partner in a figure 4 unless what? I had a hip replacement. You had a hip replacement. Okay, great. Bolster, please. Or pillow. Or how's your hip abduction? And it's okay. So again, you control the body. You notice I'm controlling the joints whenever I'm working here. Take the knee, flex the knee, put the foot where you want it. In this position, I'm going to be pressing in here, so that might be a little tight. Is that okay? Okay. For her, it's fine. For somebody else, this might be uncomfortable trying to lay like this, especially with me pushing in the adductors. Right. No, can't do that. Right. So instead, what I'm going to do is just cover the bolster with the sheet that's here. Do the same thing. See the difference? bolster. Now I can push against the bolster and she's not uncomfortable. There we go. So in this position, there's a couple of things that you need to know. One, of course, is your finger placement. Fingers have to go laterally. Okay, they can do circular friction and you can go medially or you can go laterally, but what they can't do is go straight towards the genital area. It's just your clients freak out. Okay. The other thing is you may want to consider holding the skin as you start to work a little more deeply in that adductor area, because adductor skin is a little thinner, okay? And it can be a little tender. So what we have here, right through here, that's adductor magnus, right? That big wad that you feel, big wad of adductors, a lot of that is adductor magnus. So you get an idea of where it is. It's very, very medial. Like if she had a seam, it would be right on her pant seam here. Everything back here then is what? Hamstrings. Yeah. So we want to stay in adductor territory. And, you know, in class, palpate. Make sure you know where you are. And if you don't, what do? Action. Yeah, you contract the muscle. And how would I get her to contract her adductors in this position? Karna, what is that? Yeah. Put your hand here and ask her to push against it with her. Yep. Yep, here we are. Okay, they come right up. Okay. Now she doesn't need this, so she's kind of pushing it out, but I'm just going to reset it anyway, just for her comfort. Okay. So again, if you want to, like maybe hold the skin as you're going towards the pubic symphysis here. I think some circular friction actually feels really nice in through here, rather than like straight kind of stripping things, because you have 5 adductors right in this area. And though it is a little more difficult to discern each, you know, the individual 5, that's okay. You still want to make sure that you are addressing that really tight band of tissue that comes about halfway down. You can use forearms. Remember that inside forearm that Katie taught you? You can use that in here. That actually feels kind of nice, and it's easier on the top. You're not going with an elbow because you have the femoral artery that runs right through here, right about there. So if you feel a pulse, get off of it. Yeah. You can work with petrissage in this area. And if you feel a really tight spot with your petrissage, you can hold it kind of like you do with a trigger point. So that doesn't feel too weird, right? The first time you have your adductors really worked on, your brain's just kind of processing. This is different. This is new. Like right in there. That's tender. Yeah. Just got some adductor. Brevis. Adductor brevis. Right. Adductor magnus is a little more posterior. Once we're done with the adductors, take this out. In your space, it doesn't matter where it goes. Medius or vastus medialis is right here. That's that teardrop shape. But remember, this is all adductors. So vastus medialis is not here. It goes like this. So if you need to have your book next to you so you can see where these muscles really are, vastus medialis comes all the way up like this, rectus femoris straight up like this, and then remember all this is vastus lateralis. Okay, so before you start working, really get your bearings here. Make sure that you know what you're on. Once you've completed the thigh, I'm going to do a little bit of work around the knee. Do some cross fiber friction on the patellar tendon. And I know you do this thing, the can opener. Right? But as good as that feels, like imagine if you're doing some specific work around the knee. Cross fiber friction on the patellar ligament, because that's what's right here. You can do little tiny circular friction. You can do petrissage, little tiny petrissage. That's really nice. You can use your thumbs to do a little bit of slower friction, kind of all the way around the knee. Get creative. What do you think would feel good there? And then you can incorporate the whole leg, and then that will transition you to the lower leg. And that will be a separate demo. Does anybody have any questions? Okay.